I am delighted to be facilitating this panel discussion this afternoon. We've heard from a range of different health information topics over the course of today. And I think that one common thread that has come through a lot of them is the issue of the ultimate consumers of health information and the people who are most impacted by health information, and that is the public, the people who are receiving healthcare treatment, or the people who are trying to manage their own health. So one of the questions that we've examined within the library in the past year, and if you were here for Kathleen's session earlier, you'll see that we've been trying to embed it within our own work, is the issue of health literacy, and how do we start to work within this field? What is our role as a library in discussing health literacy, in teaching health literacy, and in conducting research in health literacy? And we've also heard from a lot of different presenters today the importance of collaboration across different fields. So I am delighted to welcome here today three experts with different backgrounds, but each with very clear and articulate things to say on the issue of health literacy, the importance of the area, and also perspectives on what we can do within the Middle East region to build our capacities so that we can address some of the challenges that we know exist within the region with regard to health literacy. My own background, just because I'm asking the questions and it's always good to know who your host is. I was working with the library up until very recently as content development specialist. So I have a background in science communications and have also previously worked as an adult reading literacy tutor. So this is also an area that I personally feel very passionate about. So it's not about me. This is about you in the audience having an opportunity to engage in this discussion as well. So a couple of housekeeping notes. Obviously, if you're late joining, there are transcripts available. I know my own accent can be hard to understand. So there are transcripts available. If your preferred language is Arabic, we have got translation available as well. So please do avail of those. They're at the bottom of your screen. And you can, of course, ask questions at any point during this session. Because there are three panelists, obviously it would be helpful if you have a question that you want answered by a particular panel member, please do put their name at the start of your question. Otherwise, I will present it as a general question for them when the opportunity arises. But I do welcome your participation. This isn't just about the four of us having a chat. You are all also members of this discussion as well. So without further ado, and actually the all-important disclosures, we as a panel have nothing to disclose and no financial relationship to disclose that are relevant to this presentation. Let me introduce our panel members then to you. You should be able to see them on screen, hopefully. What I will do is I will introduce each one in turn. And because we're believers here in not necessarily reading out three-page bios as the best way of introducing people, I'll just give a quick introduction to each person and then maybe ask them to share a couple of minutes of reflection on how they came to be working in the area of health literacy and what they believe are great conversation starters for us today in terms of how libraries can start to improve health literacy in the Middle East. So let me start with Mr. Brian Galvin, a fellow countryman from Ireland. Brian is Programme Manager for Drug and Alcohol Research at the European Monitoring Centre for Drugs and Drug Addiction in Ireland. Now, that may not be a title that immediately lends itself to why is Brian here to talk about health literacy, But Brian also was co-editor of a book on health literacy that was published by De Gruyter in 2020. And the book is titled Growing Community Health Literacy Through Libraries, Sharing Global Perspectives. And it's a collection of essays by library professionals and academics working in this field. Brian is also chair of IFLA's Health and Biosciences section and chair of Ireland's Health Sciences Library Group. So I've probably answered the question already, but Brian, would you like to give us a little bit of background on how you even ended up editing the book and what your initial thoughts are to start today's discussion?
Yeah, hi Sinead, and thanks very much for the invitation. I have a background in working in special health libraries for a number of years. For the last few years, I've been working mainly in research management, but I've kept my interest in libraries. And for a number of years, I was chair of IFLA's Bioscience Group. As part of that role, we organize a special session at each IFLA conference. One year we had a session on health literacy. That's probably the most. It's probably the one I remember best and got the most enjoyment from. So together with a colleague, Dr. Prudence Dalrymple, he used to work in Drexel University in Pennsylvania. We decided that we'd edit a book on health literacy. So we invited submissions from all around the world, and finally in 2020 we published a book on a librarian's contribution to literacy. So I don't have a particular, I suppose, expertise in the topic, but I have had a long interest in it, and to the book, I think I've got a pretty good understanding of the contribution that librarians are making to literacy and where the gaps needs for change. Or just briefly, through my work in I work in public health research, mainly in the drug and alcohol field, and I have a particular interest in drug prevention, and there is an overlap there between the type of I think population approach to literacy and to drug prevention. So that's where the overlap happens. Okay, for me. Thank you.
Thank you, Brian. Thanks, Brian. So our next panel member is Dr. Dari Al-Huwail, and he is a fellow of the International Academy of Health Sciences Informatics, as well as an associate professor at the Department of Information Science in the College of Life Sciences in Kuwait University. And he describes himself as an avid health informatics leader with a view to contributing to health information sciences. So Dr. Al-Huwail, Dari, we're delighted to have you on board. I know that you have done research into e-health literacy and digital health literacy. Do you want to tell us a little bit more about your work to date in this area and what you'd like to see us discuss today?
Sure, absolutely. So thank you for the opportunity. I'm humbled to be amongst, a fantastic group of experts, and I'm looking forward to the discussions that we would have. And let me just pick on, your initial question, in terms of, the work, the research that's done, and, sort of my humble personal point of view when it comes to that. So I've been dabbling and working in the health informatics and digital health sort of space and area. And I believe as we progress with technology, or technology progresses with us, we have a great opportunity to seize. And I think, especially the COVID-19 pandemic had really exposed a lot of opportunities for us to seize. So, reflecting back on this work, especially with health literacy, and the intersection of digital health and informatics. So that's kind of the area or space I work in. So we did a study, and this was, a couple of years ago, about the e-health literacy, here in Kuwait. Grant, the study is published and everybody, it's open access so that people can look at that publication. But what I can tell you is the perception of many people perceive that they have high e-health literacy rates. So they're pretty confident about the information that they can find online. Although, it was funny, and I think we were joking about this the other day, but when we're looking at, advice for a car, we always go to a mechanic. When we're looking for advice on building a home, we'd always go to an architect. But oftentimes when we're looking for advice, on a medical or health issue, especially maybe in this part of the world, first thing that we do, we ask our friends, family members, mother, father, and maybe go to the internet and search online. And if we're not able to discern, reliable sources of information, that's when we get in trouble. And when the trouble continues, that's when we finally give up and usually go to a clinician. And, hopefully we can discuss opportunities where we can flip that and actually, enable people to access the right information at the right time, for them to also be safe. And, I'll leave it at that. And then hopefully, as we discuss, we can get into more details. Thanks.
Thanks, Dari. And our final panelist, last but not least, is Dr. Marta Fada. And Marta is a postdoctoral researcher and lecturer at the USI, and I'm going to pronounce this badly, Università della Svizzera Italiana in Switzerland. Got it. And Marta has done quite a substantial piece of research in the Middle East region before. Her research interests lie in the intersection between communications, ethics, and new technologies in healthcare. So Marta, I know, has a couple of slides for us to look at as well. So I'm going to stop sharing my screen and let Marta introduce herself. Welcome on board, Marta, and would love to hear a little bit more about your own background and particularly the work that you have done in this region.
Thank you, Chinette, and thank you for your kind introduction, and good morning, everyone. Excellent pronunciation on the name of our university. Congratulations. So maybe a couple of words just to let the audience understand why I'm here and what my work has been focusing on for the past few years. So I have a background in Arabic, so that I did my initial education on Arabic language and culture, and I also did a master in Middle Eastern Studies at SOA, but it was only when I started my PhD here in Lugano that I started to work on health literacy, particularly in the context of the MMR vaccination. I looked at vaccination literacy and empowerment as potential drivers of the vaccination decision. And it was during my PhD that I conducted a validation study in Lebanon. We validated 3 instruments to measure health literacy. It was actually one of the first health literacy instrument validation studies in the region. And since then, I've continued working in the field, and I didn't stop looking at the Middle East as a focus of interest. And one of my master's students this year conducted a scoping review to map health literacy research in the Middle East. And I'll be happy to tell you a little bit more about her findings. And just to complete the overview of my background, I did a postdoc at ETH Zurich, working more on ethics, and right now I'm doing a master on bioethics at the University of Harvard. So basically, my research focuses on ethics in different contexts. In the clinical one, I looked in particular at decision-making among physicians and communications between physicians and patients and families, particularly in the context of pediatric. I do research on the severe disorders of consciousness. I do research on research ethics in the context of epidemiological studies, looking at ethical issues in informed consent, motivation to participation, barriers to participation in population studies. And I still conduct a lot of research on public health ethics, in particular in the context of vaccine hesitancy and health literacy. So I'm very happy to be here. I look forward to our discussion, happy to share any insights of my recent research. And yes, I leave the floor to you, Sinead.
Okay, thank you, Marta. So I guess, look, the best place to start is always with a shared understanding of what we're talking about. And I don't know if you were there for Kathleen's discussion earlier when she was talking about a module that we did here in the library, teaching patient education and developing patient education materials for older adults. But one of the things that she talked about was how there are often differing definitions of health literacy. And one of the challenges we face often is that there isn't a shared understanding of what health literacy actually is. So I'll put this out to the floor, maybe Marta, directed at you first, and then we'll let Brian and Daru come in. But how would you define health literacy as it currently stands, being aware that it's an evolving area?
So it's not surprised that it's so difficult to find a common definition, because health literacy as a concept is extremely complex. And let me share a couple of slides that I prepared just to show you an overview of the most recent approaches to finding a definition for health literacy. And of course, I have my preferences. So there's been a big number of attempts to find a definition of health literacy that could be all-encompassing at the same time, and which could capture the cultural diversity in which health literacy also expresses itself. So these are three of the most common definitions of health literacy, and these are also my favorite ones. So, for example, the first one presents it as the degree to which individuals have the capacity to obtain, process, and understand basic health information, services, and skills that are needed to make informed health decisions and actions. So it doesn't really, this definition doesn't really capture the relational aspects of health literacy, which might be actually peculiar to the Middle East, where health decisions are made not alone, but together with family members, with friends. I really like the second and the third definition more. So according to the second one, health literacy is the achievement of a level of knowledge. So we're talking about declarative knowledge, personal skills, something like communications, relational skills, and confidence. So something more about empowerment to take action to improve personal and community health by changing personal lifestyles and living conditions. But this definition is more focused on health literacy as an outcome, as an achievement. So my favorite one is the third one, because I think that health literacy is not an outcome, it's also a process. And these definitions by Mancuso said that health literacy is something that evolves over our lifetime. It's about capacity, it's about comprehension, understanding, and communication. So this really captures the relational aspect of health literacy. The attributes of health literacy are integrated within and preceded by the skills. So what comes before health literacy, what drives it are the skills, the strategies, and the abilities that are embedded within the competencies that are needed to attain health literacy. And one of the most recent attempts to find a framework that really captures all these aspects that makes people literate, health literate, is this framework called Integrated Conceptual Model that was developed by Sorensen in 2012. And I think this is also a very good starting point for our discussion on how libraries can contribute to advancing health literacy at a community level. So here we really see it as a process, but also as a multidimensional concept that has to do with some socio-demographic determinants, so the environment, our social context, but also all those aspects related to knowledge, to competence, to motivation, so the extent to which we really want to change our lifestyles. We really want to take control of our health. And then all the system structural aspects such as healthcare, what is done locally in terms of disease prevention and health promotions, and then all the other factors that contribute to our health literacy and the stakeholders we necessarily need to communicate with in order to act upon our health literacy level.
Thanks, Marta. And so I guess that prompts the question, Brian and Dari, would you have any additional definitions that resonate with you? I mean, particularly Dari, I'm interested from a digital perspective. Do they capture what you would consider important?
I think so, but I also believe now there is if you will, the digital part becomes a precursor almost, right? So if a person does not understand how to navigate or discern a particularly reliable medical website that's coming from a reputable organization that's authored by, scientists or, people that are qualified or with a qualified professional background, then I feel, no matter how the person, their health literacy is, they're going to be challenged from the digital perspective. So I'll give you an example. So we did this research, and this was back in 2016 or 2017. It's also published, where we did a review, a systematic review, however, not on necessarily publications, but on applications that are available for diabetes in the Arabic language. And the scary part is at that time, there were applications and they were a game, essentially, right? And you click on the screen and it would tell you how much your blood glucose was. And obviously, that's just nonsense. It's just a game, right? But if we had people like, who were obsessed about, measuring their blood glucose, and now, here's an app and I click on this, or they can show it to other people. And you can imagine where this could lead us, to very dangerous, I believe, patient safety issues, that are just coming from somebody that maybe thought it was fun and maybe thought, that nobody's going to take it seriously. So might as well, just make it a fun thing and an app to do. So I think, we also have, especially in this day and age, I think we cannot almost separate the digital part, from the literacy part or the health literacy for that matter. So that would be my comment on that.
Okay. And Brian, when in reflecting on some of the essays that you published in the book, I mean, did you find that there were different approaches within that to how different libraries that defined the work they were doing within health literacy?
Yeah, I think Marta did a really nice overview there of the change in nature of how it's defined, and Dari's point about the current issues is very pertinent. I think the Sorensen 2012 piece is a brilliant way to understand the multifaceted nature of health literacy and how the definition has changed over the years. I think we can begin with a more clinically focused, do people understand what they've been told, and then it develops to a more public health approach, and not being would be the point in 2000 where how this changes. And Sorensen edited a handbook on health literacy just in 2019, which updates a lot of our thinking from 2012. So in terms of definition, I suppose it's subjective to pick out one that you particularly, that you're particularly drawn to yourself. I suppose because I work in a public health environment and I work in policy, I'm interested in policy. How does policy change for the whole population, rather than the earlier definitions, which were quite focused on cognitive, abilities and people's own capacity to deal with information. And I really like the what the US National Plan, it's called Healthy People 2030. And it says, and I'm just going to read it if you don't mind, health literacy occurs when society provides accurate health information and services that people can easily find, understand, and use to inform their decisions and actions. So it's a policy imperative rather than a skill or an approach or an outcome. So that I like the all-encompassing nature of that just two-line piece. Yes, it doesn't cover everything, but it understands health literacy as an objective for the whole society, and it must be a whole society approach. Now, getting into I think drilling down into what all those various aspects are would take all day, but I like to start from that idea that it's that it is a policy imperative rather than an individual skill or ability. So that's what I think.
And I think it's really interesting that we have a panel of three people who do have different approaches. And I think it does speak to the fact that sometimes when we collaborate, I think it is very important at the very outset to have this discussion. And I mean, I think one of the key takeaways already might be that when we are working in collaboration, we need to have a discussion at the outset as to what people's understanding is, and we might not reach a shared understanding, right? But at least we can understand other people's perspectives. Brian, you mentioned outcomes, and I think, you know, following on from the definition, I mean, the obvious question is, and we're skipping the bit in between of what we do to get there, but how do we measure success in terms of health literacy? How do we know when a population or an individual, because obviously there's the two levels, how do we know when we have achieved our goals of providing them with the skill to call themselves health literate? And I will give this question to all of you, because I suspect there will be different approaches to that too. So what does that look like? How do we measure that?
That's straight into the hard question there, Sinead. Yes, it's a very difficult one. There are tools, all kinds of tools that measure people's capacity to understand and use information. Okay, we have the tools and we very well understand, and it's quite similar in other aspects of public health. We have a very good understanding of the rates of health literacy, how they vary from country to country, how they depend on social background, ethnic background, you know, et cetera, and it's like other areas of public health, like smoking or whatever that behavioral aspects. We use a lot of different epidemiological tools to understand that at a population basis. We're not so good at using interventions to deal with that. Okay, so we understand the problem, we understand the nature of the problem, but health literacy is, in terms of research as a science, is actually at a very young, you know, it's a very young kind of discipline, because it's multidisciplinary and it involves trying to integrate several different areas. It's quite difficult, and so I can't answer how that would look like, because you have to decide what tool that you're going to use to actually measure that. But there are tools available, I think, and I won't go on for too long on this, but I think it's very important to note that research in health literacy it's not at the same level of development as other areas of health. For instance, a systematic review of European evaluation studies in 2017 found only 23 studies that met, you know, the criteria, and most, and with a very narrow range of research approaches as well. So I'm not avoiding your question. I'm just saying that we're only at the beginning stage to understand what a society with a higher level of health literacy. Yes, we can tell what the individual level of health literacy is, and, you know, what's the difference between good and bad, but determining what we have to do to bring a society from, because that's where I'm coming from a public health perspective, from a low level of health literacy to a higher level of health literacy, where we have a lot of work to do. Okay.
Okay. So I guess that brings us nicely on to, like Marta, I know in particular you have done work using some of these tools with AUB, and you mentioned earlier your master's student who is working in this area as well. On that outcomes question, and I guess building on Brian's comment about research, what are your thoughts?
Yeah, Sinead, you asked a very tough question, and I pretty much agree with Brian. It's not easy to answer because if we look back to the concept, it's such a multidimensional concept. It encapsulates so many things, and just as Brian mentioned, it's not something about the individual alone. It's about communities, it's about societies and what societies do for the individuals. That it's not easy to find a single measurement tool that could really answer the question on what is the health literacy level. So we necessarily need to give up on something. So of course, the easier thing would be to measure declarative knowledge. So there are lots of tools. You know, health literacy is a context-specific concept. So we could measure mental health literacy. We could measure vaccination literacy. It's usually a set of questions where the answers range from you know, right or wrong or I don't know, and that's pretty straightforward. But we fail to capture our understanding of all the other dimensions that are dimensions related to individuals' motivation, individual empowerment, commitment to address one's health and to change one's lifestyles. And unfortunately, there is not one single measurement tool that is able to capture all dimensions, but also because there's still not agreement on what health literacy really encapsulates. It's just so many things, and research keeps going, and we keep finding out about other things that deserve to be included in this concept. But what I wanted to say is, so we have an overview of population health literacy levels, focusing on particular dimensions of health literacy, such as declarative, procedural, or judgment skills. But let us not forget that we have a risk of misunderstanding. So being health literate and making an informed decision doesn't mean that we do the right decision for ourselves. I mean, we still have a right to make mistakes and to make the wrong decision. So we need to remember that no matter how health literate we are, no matter how many investments we do on improving individuals, communities, health literacy levels, people still have a right to decide for themselves according to their own wishes, preferences, and values, and this might not align with standard of care or with what a reasonable individual would consider the best decision. So this is something to keep in mind so that we avoid making this this policy.
That's it. I think that's very topical at the moment, right? In the light of COVID and COVID vaccination and all of that discussion, where we start talking about vaccine mandates and things like that. So it's a good point to bring up. I guess I'm just going to loop back because I'm interested as well to hear what Dari's perspective is, because sometimes I think when we think about digital literacy, we think it's almost easier to measure in some way because it's on a screen and you know, you can somehow test it. Dari, I'm assuming that's completely a false assumption, and that the same complexities that apply to health literacy also apply when we're talking about e-health literacy. Am I right?
Oh, absolutely. And you know, by far toughest question, you know, on this panel. So thank you for raising it. And I agree with everybody. I don't think we can come up with, you know, a particular successful, comprehensive way to actually measure the impact, right? That you know, the health literacy or even digital health literacy would have. But you know, I'd imagine maybe because just like, you know, what Brian had mentioned, you know, because it's you know, it's still at a young age in terms of the field, and you know, the explosion of information and flood of information that we're getting, I can imagine a world where you know, when rumors start flying about that people have, I guess, a certain level of literacy to discern, you know, whether this is something that I can trust, or this is, you know, it has the elements for me to trust this piece of information and act on it. And just like Marta, you know, wonderfully and beautifully said it, you know, we still have the right to refuse. We still have the right to disagree. You know, and, you know, I think the vaccines and the whole rumor mill that has been, you know, spinning around has just been fascinating. I respect very much my friends and colleagues who, you know, for one reason or another, still do not want to get vaccinated, you know, but at least, you know, let's agree that, you know, this nonsense of, you know, maybe again, you know, I'm just saying it, you know, out there, that, you know, we'll turn into zombies, you know, if we you know, get vaccinated. And I would like to believe that if there was evidence, but because there's no evidence, then, you know, we should stick, and we're all, well, at least on this panel here, right? We're scientists, we have a duty to society, and, you know, in science, we believe in evidence-based, and, you know, show me the evidence and let me, you know, trust you. So I think once we have that understanding, you know, and making it into the community level, I think that would be where I think we can call that a success. Measuring it is a very hard part. You know, in digital, you know, it's very easy. Show me that you have an ICDL certificate, that you know how to navigate a computer, turn it on, you know, do some of the basic functionality. But I think we would be successful, you know, once people are, you know, just have this common basic understanding that everybody in the community says, no, you know, there is a question mark about this, you know, let's study it further and let's take, you know, significant action.
So I guess it brings me to a question, and I'm looking at the time, I think we could spend all day just debating the meanings of health literacy, right? But we talk about two things really as to where libraries can play a role. And one is obviously in the area of research, and the other is in the area of interventions. And I guess, because it's very arbitrary which one we focus on first, I'd like to talk about research for a second. And you know, the importance of research, and we've mentioned the scarcity of evidence, and coming back to that word, you know, we need evidence to make decisions. And yet it's clear that even in those areas, geographical areas, where we would deem there to be a lot of evidence, there possibly isn't the depth of evidence there. What role, if any, do libraries have in this issue? And what are the key factors that we need to be considering if we're planning on conducting research into health literacy, specifically in the Middle East, but I think it probably covers the full world. Dari, do you want to have first attempt at that?
Sure. So I think, you know, the libraries, generally speaking, have a central role to play. And, you know, being part of this region, having worked in this region, I can tell you, I think we're doing great things. And I think this, if anything, this virtual event is, you know, a testament to that, but is bringing multi-professional, multidisciplinary, interdisciplinary, right, researchers and teams together on the same topic or same issue. I think, you know, in comparison to maybe some of our colleagues from around the world, we're very protective of our areas, right, or our domains. So if it's something that relates to libraries, then if you're an expert in libraries, then you're permitted. If not, then that's the door and that's where you leave. But rather, I think we need to have an open policy where we are inviting, you know, many stakeholders on the table. So that would be number one. And then I also think, you know, something that we do not do as much, and I wish that we would do more, but is involve the consumer, you know, in this research from the beginning and put them in the steering, steering position, right? Or if not in the steering position, right, on the passenger position, right, or the co-pilot position. Because at the end of the day, if we're trying to do this research and inform the you know, policy or inform interventions, right? Why can't we have, you know, the consumers who will ultimately be benefiting from these, whether it's services, research, or whatnot, they need to be involved. And I'm speaking, mostly from the focus, if you will, from this part of the world. This is not a generalization, so please don't take my word as, if there's no collaboration, if there's no care about the consumers. But I feel there is more room to grow, and that would be my answer to that question, Sinead. Thanks.
Okay. Thank you. And I think that is an interesting perspective, and probably echoes what we've heard in some of the earlier sessions today as well, about how we get very focused on the production of knowledge and forget perhaps that there's a consumer there that can provide us with input. Marta, do you have any thoughts on that?
Yes, I do. So first of all, libraries have a privileged position to contribute to health literacy at a community level. They're trusted, welcoming, and safe places. And let us not forget that frequent users of libraries are also those that come from more disadvantaged portions of the population, and those who tend to have lower health literacy levels, from what we know from research. Older adults, people from minority groups, and people who do not have access to internet, who have a lower socioeconomical status. So in that sense, libraries can really help research, particularly when it comes to understanding social disparities and health literacy. And then I have one thought, which is about in which ways libraries could help advance research on health literacy. So on the one side, there is one track that I believe is quite straightforward, quite easy. They could represent, a pool where we could easily use a deductive approach, and assess the health literacy needs of certain communities. So by way of administering questionnaires, for example, that have been already validated and are widely used. But I think it's the second track that can really help advance research. And it's the more inductive approach. It's that effort that would help us explore and document narratives about what really matters to certain communities when it comes to health literacy. So it's not about assessing local needs from a more deductive perspective on the basis of what we already know, but it's really about collecting new information and really trying to understand the meaning that people attach to health, to prevention, to caring also for others in the community, to health promotions, and so on and so forth. And I think in that sense, it would really allow health literacy research to go to a turning point, and going into the direction of a true participatory action research, where the agenda of researchers is not dictated by researchers themselves, but by potential participants. So I really favor this track. I think by training librarians and library staff in general, we could really collect new information on the narratives that are particular to local communities.
And I think that's a really interesting perspective. No, bless you.
Yeah, thank you.
I think that's a really interesting perspective, and probably one I hadn't even considered fully before. Brian, I'm sure in the book and in the course of your discussions with IFLA stakeholders, you've had plenty of discussion here about how libraries can contribute to the research. And I'm particularly interested as well, knowing that you're responsible for providing the evidence that gets policy made, right? What do you look for? And what should we be doing?
I struck by Marta's contribution. I was thinking about making a point, but she put it, I think, far more eloquently than I was going to put it. It's spot on. I think I'm glad she used the word trust, and it has probably come up in her own research. I'm assuming on the ethical aspects of this. Trust, not just as a value, but as a mechanism that's key to communication. We've looked at concept of trust in the area of drug treatment and other areas, and as a mechanism it is an essential support to communication and allowing people to understand. So I think public libraries especially have a position of trust in the cultural and intellectual life of their own communities. And I really like this idea of participatory research that Marta was speaking of. There's a concept, community-based participatory research. So it doesn't pretend that they are the experts in research, but it does acknowledge them as a source of evidence. I believe in population studies. I've done population studies, and they're extremely important to get a good representative sample. But that quantitative approach only gets you so far. I think there is a possibility to get a really a deeper understanding of what health literacy means in everyday life. And I think libraries are very well positioned there. Number one, to provide information to people, but also to bring in people to that research. But they can only do that, of course, in collaboration with the academic researchers, of course, and that's the other key part of this. But I think the idea of trust also ties into the point Dari was making about, yes, we have masses of information available to us, but how is trust built between the providers of the good scientific information and the consumers? I mean, I could talk about research, librarians at each stage, but I won't go on. If we have time, I'll come back to that again. Okay, thank you.
I know, and it's that constant question of if we have time. Just a reminder to anybody in the audience, if they have a question, anyone listening, please do put it in the Q&A box. I haven't seen anything pop up yet, but I may be missing it. I could come back to, I think we have to move on just from the research question for 1 second, just to quickly look at the interventions, because otherwise we're going to run out of time to discuss them. I hear a talk about the public libraries and the interventions there. I guess one of my questions is around what's the role for academic libraries here, because health literacy, obviously, Dari, you mentioned it, like initially what ultimately happens is that somebody has to go to their healthcare professional, right? But who teaches the healthcare professional about health literacy, and who prepares the healthcare professionals so that they have the awareness and the understanding of the issue of health literacy? And I think we've provided the case study earlier where we've attempted to sort of build that into the curriculum. But I'm wondering, particularly Brian, knowing the case studies that you showcased in the book, what has worked? What have we seen as evidence of where maybe academic and public libraries have worked together, or academic libraries have really made an impact in tackling health literacy?
The examples are quite few. Okay, and I'm not saying that they're not out there, but the I think most of the contributions to our book were there. There were case studies, and mainly public library focused. Okay, they would have worked with head libraries in academic institutions. There are some examples. There's a really fine example in Philadelphia where a library was established with two public clinics, and they've worked very closely with the health sciences faculty in I think Drexel University. It was and that's a really superb example, because it locates the problem in a very deprived area with a large urban space, but very much providing facilities in the community with the library and tied to the university. There are not a huge number of examples of that, but I think it's a very fine example in itself, and it's very well evaluated as well in terms of the service provided, not the outcomes as such, because that's a much wider as a course. Yeah. But yeah, just one, I think librarians, what the different fields they're going to work in recent years in systematic reviews, in data management. They work much closely with researchers in academic, in their own spheres. And I think there are opportunities there to, again, the notion of trust. They are trusted collaborators, and so that has opened up more opportunities.
Thanks, Brian. And Marta, I see you want to respond.
Yeah, there is one intervention that was done in the UK 2 years ago that I think is really nice, because you mentioned teaching health professionals about health literacy and what they could do to improve people's health literacy. So it's called Dr. Jargon Game, and it was delivered by public and academic libraries to recently qualified doctors. And so in this game, they gathered doctors and asked them, they challenged to describe a health term without using jargon. So they actually realized that most terms they used that they considered to be familiar and easy to understand were actually extremely difficult for lay people to understand. And so they challenged them, they came up with this list of words, and then they invited them to use the easier words with their patients. I'm not sure whether there was any evaluation of this program, of this game after that, in the local hospitals where these people, these players were working. But I found it really interesting, and it's actually something that I've been thinking about including in our medical education program here in Lugano, because it's very easy to do, it's quite quick, but I think it has a huge impact on how physicians and healthcare professionals in general may communicate with patients.
That's it. And I think we found in our experience that it does, I mean, the healthcare professionals we work with are very, very aware of the needs, the communication needs of their patients and the needs that they have for information, but they're often just not taught within the curriculum some of the skills they need to develop that, right? Gary, I'm going to loop right back to the comment you had at the start about even the app that the population were using to blood glucose. How do we teach people the skills? I mean, I think one of the things is we can provide all the tools on best practice on writing evidence and best practice on writing lay summaries of research, but how do we teach people the critical skills? I know there are tools out there now, but what have you seen that works?
So I hope this issue will be solving itself as we move forward, but my fear is that we will get more complex issues, right, as we move forward. So it's not automatically going to solve itself. But I think, introducing, some of these concepts in the, K through 12 sort of schooling system, I think is very, very important. And now, maybe this is, I'm preaching to the choir here, but, the libraries have a very central and an important role to play, right? Where traditionally we're thinking of, you walk into a library and, you go to the information desk and you ask, hey, can you help me, find this, piece of work? I suspect, perhaps maybe the person can go to the library and don't think of the library as a traditional, books and papers, but, as the central information hub. How do I navigate this, complex issue, or how can I find more information about diabetes? Are there particular apps that, you recommend and that are trusted and they're, constantly updated? And I think this is a role, that is very key, and I think would be very helpful because, our healthcare professionals are, quite busy taking care of and doing their normal routine operations and routine jobs, that I think, the information professional, so this is where they come in and this is where they shine, to hopefully help solve it. And I think, now moving away, or not moving away, although, you know, I love reading books, right? I cannot, you know, read a book on an iPad, I have to admit. But you know, I think, you know, moving into this new role, I think is critical and key. Thinking that, you know, the librarians are becoming more of an information professionals, and they can help people navigate these, you know, sometimes difficult waters or environments, and really they can be the trailblazers moving forward.
And I agree, and I think it's echoes of the conversations that we've had certainly internally about how we're perceived beyond the books and the resources that we provide, right? But I think that looping it back to the discussion that libraries almost need to become better at marketing themselves and marketing the resources they provide. If I reflect back on, there was a presentation this morning from Ms. Alia Faye from Qatar National Library, and she did a study on the information seeking habits of women in Qatar, and found that 75% of them didn't even consider going to their local library for health information. So I think that there's a body of work there to do to convince people that this is it is a source of information. I'm looking at the time, there's 5 minutes to go. What I might do is, I know all of you put together some key points and takeaways that you wanted to share. I think we could spend all day discussing this issue, right? And the issue of health literacy. But let me just pull up the key takeaways and just make sure that we've covered them all. And if there's anything else that any of you would like to add, we can do that just in the last minute or two. So what I've heard us say, and we've discussed, is that libraries are well placed to play a role in assessing local health literacy needs and document narratives. And I think this comes back to what you said, Marta, about how there's interesting approaches that we can take to involve the community as well, and maybe let them lead what it is that they want us to document. And then, given the multidimensional nature, and we probably haven't talked sufficiently, but if we had more time, about the partnerships with stakeholders, but I think it is clear that libraries are at a sort of a hub of different stakeholders, right? So we have that engagement with healthcare professionals and public health officials and the consumer audience. And that, Brian, you challenged us rightly at the start about being thoughtful and about the research that we conduct and helping to contribute to the evidence base, particularly through evaluative studies. And I think that could be something that's particularly relevant for this region. And then I know, Dari, you've spoken several times about how we need to really focus on the consumers of health information when we talk about health literacy and devising interventions for that community. And Marta, you made an interesting point earlier about the particular needs of different groups of consumers, that we can't just treat the audience as one homogenous group of people. And then digital health literacy is obviously becoming paramount. We're all aware that people are getting more and more information online, and that, again, collaboration is key. So can I ask, with 3 minutes to go in this session, would all of you be able to provide even one key takeaway or thought or something that you would like participants to leave with today, that might trigger a research project or a collaboration or something that we can do to really help to give this life and carry this forward? I'll start with Marta, since she's the one next to me on the screen. Marta.
Yes, thank you, Sinead. Yeah, so to all healthcare professionals that are in the audience, because I spend a lot of time on talking about what libraries can do to individuals and to communities, but I have a final remark on what libraries could do for healthcare professionals and hospitals. I think it would be really nice if hospitals, public health institutions, physicians, nurses could have libraries have a reference point for improving documents, the readability of informed consent forms, promotion material that is developed by public health institutions. So going back to what Dari said, it would be good if libraries became the information hub for people, but also for other stakeholders, because as Dari mentioned, physicians do not have the time, to improve these documents, and might not even have the skills to improve the reliability of the information that they provide to patients. But if libraries are information specialists, right? So they are well positioned to take that information that physicians want to deliver and really make it easily understandable, easily accessible to patients so that they could really use it for making informed decisions.
Thank you, Marta.
Thank you.
Brian, have you any thoughts?
Very quick, yeah, very quickly. There are models. They're like clinical librarians that work in hospitals for teams, health teams. The embedded librarian idea, who work with teams working on systematic reviews. I think there's a real possibility to have the notion of a health literacy librarian who would be embedded in a team of public health workers, and clinician, and communications and policymakers to advance these ideas and use the knowledge and skills that librarians have. Okay, that's it.
Thank you, Brian. And last but not least, Dari.
So just 3 key words, because we're out of time. Collaborate, innovate, and disseminate. Thanks.
Fantastic. Well, you've laid down the gauntlet for everybody here, and I'm sure you've left people with more questions than answers, but that's a good thing. And hopefully people can see potentially roles that they can play in this area. Marta, Brian, and Dari, I want to thank you all very, very much for giving up your time this afternoon. It has been an absolute pleasure.